biologic, I should say, response modifiers. One thing that these BRMs do is stimulates the body's immune system. So we have to keep in mind, patients' immune system are deteriorated when they have cancer. So our world with these BMRs is to stimulate that immune system. So these are functions that enhance the immune system by these reasons. Okay? So those 5 functions of these BRMs, so be sure to look at those. One of the things is interferons. Interferons slow the growth of the cancer cells, and they stimulate white blood cells to fight cancer. So they're actually doing a 2-in-1 kind of thing. Interferon also takes care of the cancer and helps the immune system build the white blood cells. So interesting in that aspect when it comes to interferons. They do 2-in-1. Excuse me. Stimulating colony factors. When I think of patients that are getting rid of that good stuff, I'm also thinking about how to beef them back up. This is where the colony stimulating factors come in, is to beef them up. So it treats neutropenia in one aspect. One, neutropenia is a decrease in neutrophils. So if we know anything about immune system, we know the neutrophils are the first attackers, right? So we need to beef them up. Also, the actions, there's more. They reduce the bone marrow recovery time, blah, 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 blah. So not only do we have ones that treat the neutrophils, we also have ones to beef up the red blood cells. Erythropoietin is the most common one of our increasing our red blood cells. Erythro, you know that already means red blood cell anyway. So erythropoietin. And then we also have another friend of erythropoietin. So that's red blood cell. Then we have one that also helps with, can you guys see when I'm over here? Yeah. Yeah? Does that help me when I'm speaking? Filgastim. Nope. No R. Filgastim. Right? Yep. So that enhances the neutrophils also. So erythropoietin's for red, filgastim is for whites. Interleukin-2 increases the growth of T cells and B cells. The problem with interleukin-2, the big side effect, technically adverse reaction, is multi-organ dysfunction. So it's dangerous in the aspect of can cause organ dysfunction. So with our biologic response modifiers, monitoring the renal and kidney function. Let's talk about chemotherapy again, and let's mention that it's toxic to the liver and to the kidneys. We know almost everything metabolizes to the liver. We know that almost everything excretes to the kidneys. This is a highly toxic medication that can cause dysfunction as a whole. So yes, we mentioned it here, but if you think about it in the back of your head with the chemotherapy as a whole, you're thinking about that liver and kidney function also. And then, these might be a patient that says unmanageable nausea and vomiting. These might be a patient that you would want to pre-medicate, right? To decrease that nausea and vomiting as a precaution. Questions about those anti-cancers as a whole?